Welcome to Swati.E.Learning channel. Today in Pediatric, topic is Pediatric Emergencies. So there are some conditions that will be treated as a Pediatric Emergencies. Children presenting with the following signs should be treated as emergencies, that are obstructed or absent breathing, severe respiratory distress, central cyanosis, sign of shock, coma, seizures, or in a child with the diarrhea, any two signs of severe dehydration signs. Definition: critical illness: any severe problem with the air, breathing, and circulation, like ABC, or acute deterioration of conscious state, includes apnea, that is, absence of respiration, upper respiratory airway obstruction, hypoxemia, that is, less oxygen in the tissues, central cyanosis, that is, bluish discolorization, severe respiratory distress, total inability to feed, shock, severe dehydration, active bleeding requiring transfusions, unconsciousness, or seizures. Emergency triage. Triage is the process of rapidly screening sick children soon after their arrival in hospital in order to identify those with emergency signs who require immediate emergency treatment, those with priority sign who should be given priority while waiting in the queue so that they can be assessed and treated without delay. Non-urgent cases who have neither emergency nor priority signs. So emergency signs, what are they? A, B, C. Airway, breathing, circulation we have to assess. Airway we have to assess for the obstructed breathing, central cyanosis, respiratory distress, and weak and absent breathing. Circulation we have to assess for cold hand with any of capillary refill less than 2 to 3 sec, and weak and fast pulse, slow, that is 60 beat per minute, absent pulse. Immediate transfer if it is respiratory obstructed, immediate transfer to the emergency area, that is, start the support procedure and give oxygen way if possible. Coma, convulsion, and confusions, these are the convulsions view. So priority signs, what are they? Tiny sick infant aged less than 2 months, temperature very high, more than 39 degrees Celsius, trauma, major trauma, pain, child in severe pain, poisoning, mother report poisoning, pallor, severe pallor, restlessness, irritability, floppy, respiratory distress, referral has an urgent referral later, malnutrition and visible waste. Front in the quick clinical review as weight, baseline, and observations are the priority signs. Dehydration. So here you can see in the pic there is a condition that is results from the excessive loss of body water, and in a severe acute malnutrition. Dehydration is caused by untreated diarrheal decision which leads to the loss of water and electrolytes. Types of dehydration. There are three types of dehydration: isotonic, hypotonic, and hypertonic. Then here you can see what is the difference. That is, acute diarrhea after vomiting greatly will be affecting isotonic. Isotonic, here you can see that is 130 osmol to 150 osmol, and hypotonic, that is the sodium is less than 130 osmol per liter, and hypertonic is the more than 150 osmol per liter. So here you can see the electrolyte loss may in same proportion or water loss. So intravascular fluid, extravascular fluid, and the plasma level. So it will be getting the plasma and the interstitial fluid, and the cell will be getting the isotonic, hypotonic, and hypertonic. So here there is a three important differences. So causes of dehydration, what are them? Fever, diarrhea, vomiting, decreased ability to drink or eat without any. So viral, bacterial, and parasitic infections are also maybe caused. So increasing sweating from very hot environment, or excessive urination in the diabetes condition, or cystic fibrosis, celiac diseases that also cause the dehydration. Burns and the blood vessels can become a damages, causing fluid to leak into the surrounding tissues. What are the clinical manifestations? If you see, there is a certain divisions in the manifestations: skin color, temperature, turgor free, mucous membrane, tearing, salivation, fontanelle, body temperature, pulse, respiration, behavior. There are the certain criteria of the manifestation, that is depends on the condition, that is loss of water between the isotonic and loss of water of the hypotonic and hypotonic. Hypotonic will be less, and hypertonic will be loss of salt in the excess of water, and hypertonic is the loss of water in the excess of salt. So according to condition it is given that color will be gray, temperature will be cold or cold or hot in the hypertonic, and turgor will be poor, very poor, or fair in the hypertonic. Feel by the dry, clammy, and thickened duffy. Mucous membrane is dry, slightly moist, or the purged. So here are the certain conditions that tearing in salivation will be absent as it is a loss of water, and there will eyeballs will be sunken, that there is a loss of water. Fontanelle will be sunken, and body temperature will be subnormal or elevated, or pulse will be rapid, very rapid, or moderately rapid. Respiration will be rapid, and behavior will be irritable and lethargic in the children. So they will be seen as extreme hyperactivity and odd in the stimulation. Now, management. Assessment for the condition of the eyes, ears, mouth, and lung, and the thirst. So we have to be very alert on the normal present points. So we have to assess all 3, 4, 5